Good evening, everyone. Welcome. I'm Maureen Wennick. I am the community program uh, coordinator at the FACE Syndrome community, and this is FACE Syndrome Awareness Week. This is our Zoom meeting for the kickoff of the week. Dr. Metry and Dr. Siegel are on this evening. I just want to thank everybody who has participated so far in FACE Awareness Week. I see there's been some frames posted on our Facebook group, which is really exciting. And if you still want to get your frame, let me know. If you don't have the link, it is on the showyourface.com website. You could pop in there and request your frame. That's where all the special events are as well. And this week we are designating our donations to research. One special event we have is Dr. Metry is running the Race for FACE. She is doing the Boston Marathon. And part of that is she has raised money for research. And it's PEDRA, the Pediatric Dermatology Research Alliance, and FACE. We are working together along with Dr. Metry to try to help get her research funded. So money that is raised, we will be donating $1,000. The first $1,000 that comes in will be donated over to PEDRA in support to Dr. Metry. And if we get a whole lot raised, we may be able to even donate more. So that's pretty exciting. If you have any questions, always reach out and ask. I'm always happy to answer your questions. So let's start. Dr. Metry, welcome. Dr. Siegel, welcome. I think you are up first. Dr. Metry, do you want to introduce yourself and all the great work that you are doing?
Sure. Well, welcome everybody. Dr. Siegel and I are very happy to be here. And we thought, since we're starting out, that I would give an update on FACE and lumbar syndrome, and then Dr. Siegel's going to follow me with an update on the registry. So and then we'll have probably 30 minutes for questions or so. So that'll be nice. I'm a pediatric dermatologist, for those of you who I have not had the pleasure of meeting yet. I live in Texas. I was at Texas Children's Hospital for a very long time. And then last year I changed jobs and I'm working at a place called Driscoll Children's Hospital in South Texas. So it's a very mission-based community hospital that serves a large area of South Texas. So yeah, I think sometimes, in your career, your life, you reach a point where you're ready for a change and want to do something different. So I really feel like there's a lot of need in South Texas. So yeah, I'm doing a lot of in-person and virtual work down here, and I'm really enjoying it so far. And it's just telling Maureen, it's also on the beach, which is really it's really nice and fun. All righty. So it's a little bit about me. I'm on the board of the directors for the FACE syndrome community at the moment. I'm really involved, as Maureen mentioned. Dr. Siegel and I both are in the organization called PEDRA. That's the Pediatric Dermatology Research Alliance. So that's a group of like hundreds of not just pediatric dermatologists, but other researchers who do research work on children with skin disorders. And within that big umbrella, we have a group that's just dedicated to children with vascular birthmarks. So, and I'm chair of that group this year. So the research funding that Maureen was talking about is going to go into the PEDRA group specifically for FACE and lumbar research. And it's not to me. It's going to be, I'm hoping it will really Dr. Siegel and I are really hoping it will inspire like younger investigators, by providing seed grants and really try to increase awareness of both syndromes and also inspire more research as we're moving into the future. So thank you, y'all, for your support. Really appreciate that. So I am going to talk about FACE and lumbar. Can anyone raise your hand if you are a lumbar family? I'm just curious to see if we have anybody on who's lumbar. Yeah, we're really trying to over the past year really we've done a lot of work in the lumbar space. And I'm very interested in that syndrome because face and lumbar are very similar to each other, um, because they're really like what we would call sister syndromes. So both of them have the characteristic, segmental patterned hemangioma of the skin, and that's the first sign. But then regional to that hemangioma in the same area, they tend to have differences in the way the organs developed regional to the hemangioma. And so they're kind of mirror images of each other. It's just one of face affects the upper body and lumbar affects the lower. The other thing is that over the past couple of years, 2 or 3 years, there have been babies reported who have both features of both face and lumbar. And in that situation, usually the baby will just meet diagnostic criteria for either face or lumbar, but then also have features of the other. So lumbar is interesting to me because I think, whatever we learn about one of the syndromes will also teach us about the other. So I think awareness, learning about both is very, very important. So these are the face and lumbar acronyms. They're both kind of a mouthful to remember, I know. Um, but important for you all to know is that, the vast majority of children who have face and lumbar syndromes do not have everything on this list. They might have just a couple. It's really, really, really rare to have everything in the acronym. And we'll talk a little bit more about each of the abnormalities in the acronym in just a second. So how common are they? So if we see a baby who has a large segmental facial hemangioma, the risk of that baby meeting diagnostic criteria for face syndrome is about 20 to 30% of the time that will be the case. And there have been about 300 to 400 people reported worldwide. I think Dr. Siegel has about 200 children in the face registry. Lumbar syndrome may be rare. I say maybe because lumbar syndrome, we've been studying face for, 25 plus years. Lumbar syndrome is about 10 to 15 years behind face. So it may or may not be rare. So far, there's about 150 children who've been reported, but the incidence may be similar between the two. And both lumbar and face are more common in girls, but there are more boys with lumbar than face syndrome. So with face syndrome, about 1 out of every 6 babies is a boy, whereas in lumbar, about 1 out of every 3 babies is a boy. And then the other thing is face and lumbar tend to occur in babies who are, term normal birth weight singletons. And that's in contrast to hemangiomas overall that are more common in low birth weight, premature, twin and triplet infants. Those are all big risk factors. Um, Both whether a hemangioma has face or lumbar or does not, all hemangiomas are more common in Caucasian and Hispanic infants. And there are no reports of familial inheritance with either face or lumbar syndrome. We get that question a lot. Never been more than one family member reported. Okay, pathogenesis. I'm not going to talk about this too much because I think Dr. Siegel's probably going to talk about this some as well. But there, with syndromes that we really don't know the cause, there's often the situation where there may be more than one reason in a baby for these things to happen. We know that whatever the reason is, it happens very, very early in utero, somewhere between 4 and 12 weeks gestation. And we know that because that's when the organs are developing that we know are affected in face and lumbar. A lot of interest in, is it some sort of blood vessel disruption? Because we know that hemangiomas are a response to hypoxia, low blood oxygen. And so if you have abnormal vessels within the organs, within the skin, is that the reason, that the hemangioma develops? And could that also be a reason that the organs don't develop normally? Dr. Siegel is doing just a ton of work looking at genetic factors and trying to figure out, is there a gene that's somehow influencing children to get lumbar face? And she has found a genetic mutation in a pathway that is called PI3K that affects blood vessel development and other things. But that's only been found in a few individuals with face syndrome. It's not the causative gene. It's just been found in a few. But it's interesting and something that I think she'll talk about more and is super interested in. Abnormalities in neural crest development. So neural crest cells are cells that have the potential to develop into many different cell types. They can be pigment cells, blood vessel type cells, different things, and that's been looked at. And even things like, diet. NAD is a type of vitamin. You see it in niacin and tryptophan vitamins. And this has not been found in humans, but in mice and mouse models, mice who were made deficient in NAD developed a lot of the birth anomalies, changes that we see in lumbar syndrome. So lots of different potential reasons, and it may, like I said, be a combination of things, but that's what we're hoping to figure out. And that's where, again, Dr. Siegel will talk more about this. So this is some work that Nita Hegstrom, who's a very good friend and colleague of Dr. Siegel's and mine, has done, where she's looked at the face hemangioma and mapped that hemangioma out and tried to figure out, okay, if a baby has a segmental hemangioma at the forehead or the chin, what does that mean for that baby? Or what are the chances that they will have, other organ anomalies or differences? And so she's mapped the hemangiomas into 4 different regions. So they don't just occur, randomly, they tend to occur in patterns. So these are the patterns that they follow. So there are 4 main ones that affect the face. There's also what she's recognized as a new C-shaped area that affects like around the ear, the scalp. And the larger, more extensive the hemangioma, the more segments that the child's affected by, the greater their risk of face syndrome. And there have been babies reported too who don't have a facial hemangioma at all, but just have a segmental hemangioma of the chest or the arm that also meet diagnostic criteria for face. So it doesn't always affect the face. The only area of the face that seems to be at low risk for face syndrome is this kind of cheek parotid area. But everywhere else where the face is affected can be a risk factor for face syndrome. Then the lumbar hemangioma. So most babies with lumbar will have a pretty extensive hemangioma. That is segmental or patterned again. It may affect the lower back. It may affect the buttock or in pelvic area. And about 1 out of 3 babies, it also involves the entire lower leg on top of that. So very extensive. Every once in a while, both legs will be affected, but it's typically just one. And it's often what we call this IH-MEG, this minimal or arrested growth morphology. So the lumbar, you can see this in face syndrome, but the lumbar hemangioma can often be pretty subtle at first. And as you all know, the hemangiomas are not fully there at birth. They're pretty flat and can just be kind of red or just look like broken blood vessels. And then they start to grow after birth, right? So the diagnosis of face or lumbar often isn't made, right away, or sometimes that birthmark is believed to be something different than a hemangioma because they can be confusing at first. So this is even more so in lumbar with this IH-MEG hemangioma because it stays pretty flat. even as the weeks go on, except that over the weeks, it will show some signs of proliferation, like you can see in this baby here, how it's becoming raised up on the edges. And even though this IH mag that we often see in lumbar is very flat and is really just more subtle in the skin, it's very prone to ulceration, so skin breakdown, and that can happen in face and lumbar, but is especially severe, can be especially severe in lumbar. These are other skin findings that we can see on exam, and these are things that your dermatologist looked for when they examined your baby or will examine your baby. So, and this is another, I just want to point out how face and lumbar, again, have a lot of overlap between them and share certain features. It's quite striking. So sometimes in face syndrome, you'll see where the skin in the middle of the chest and the abdomen didn't come together properly and either created like a defect in the skin in the sternal area, or there's a pit, or sometimes you'll see where there's just a scar that developed from that change in the way the skin developed in that location. That's called the supraumbilical raphe. And we see the same thing in lumbar very rarely, where in face syndrome, the skin difference extends upward from the umbilicus, and in lumbar syndrome, it extends below the belly button. So it's very interesting. And then Dr. Siegel and I have also done some work lately looking at these skin tags that babies with face and lumbar syndrome often get. And, we see skin tags a lot. Skin tags are just extra normal skin. But the skin tags we see in face and lumbar syndrome aren't actually skin tags. They look like them, but they actually are a mix of different tissues. One of the tissues involved is skeletal muscle, and that's a really rare thing to see. And all these little things that we learn and realize can be clues to the reasons why face and lumbar happen. So that's another thing that we see in both syndromes. And then in lumbar syndrome, other things that you can see on physical exam would be sometimes in the middle of the lower back, over the tailbone lumbosacral area, you can see other birthmarks. So for example, a pit or a scar, or sometimes a skin tag, things like that we see. You can see genital abnormalities in lumbar. So at its most severe in lumbar syndrome, there have been babies where it's really even hard at birth to tell whether a baby is a girl or a boy because of those genital abnormalities. And then sometimes in lumbar too, when I showed that picture, when the whole leg's involved in 1 out of 3 children, there can sometimes be differences in the length of that leg or the size of that leg, or there can be foot deformities. Those types of things can be visible on examination too. Other organ anomalies on the inside that we wouldn't see on the skin in face syndrome. So by far and away, most common in face syndrome, we will see changes in the way the medium-sized arteries in the head and neck developed. So that's there in over 90% of patients. And there is a potential for those blood vessel abnormalities to change over time. Okay, that's uncommon, but we know it can occur where there can be something called moya-moya phenomenon, where those blood vessels become narrower over time, and blood vessels around that abnormal, or what we call stenosed or narrowed vessel, more blood vessels develop around it to compensate for blood flow there. The risk of stroke in face is very rare. I know that is probably the #1 fear for parents, right? But just so you all know, that's a rare risk. It does happen, but it's rare. We can also see changes in the way the blood vessels in the heart developed, especially within the aortic arch. Sometimes the brain itself, especially the back of the brain, did not form properly. We'll see that. That's called posterior fossa malformations. And changes with the way the eye developed are less common, but we'll see that in phase 2. And then other things that aren't as well known, but important for you all as parents to be aware of, are that there can be differences in the way the teeth developed. There can be an increased risk of cavities. So I think I posted that in the blog not too long ago under the PHACE syndrome community. There can also be endocrine problems as well. So particularly things like growth hormone deficiency or pituitary abnormalities. So following things like, growth and development in children with PHACE is very important. Okay, lumbar. So other things besides what we see on the skin in lumbar syndrome, by far and away most common in lumbar is where the spinal cord did not develop properly. So where there can be a connection between the birthmark, the hemangioma, and the spinal cord underneath. So normally as your child's developing, the spinal cord is free to move and moves up and down with jumping and running. When the hemangioma connects to the spinal cord underneath, that's called tethered cord syndrome. And that means that with any kind of stress, like jumping, running, that tether can lead to damage and tearing of the spinal cord. And that can lead to a number of neurologic problems, as you might imagine. There can be, as I mentioned before, differences in the way the genitals developed or the anus, the rectum. So this is an example of something that is fairly commonly reported in boys with lumbar syndrome. This is called a bifid scrotum, where the scrotum is separated where it should not be. There can be changes with the way the kidneys developed. There can be changes with the bones in the pelvic or lumbar area. And then in a small number of reported children, there have been blood vessel abnormalities documented, especially when the leg is affected by hemangioma. I really think that the blood vessel problems, differences are much more common in lumbar than just 10%. But as we know from PHACE syndrome, you have to look for those blood vessel abnormalities specifically, right, by doing an MRA, MR angiography. And that hasn't been done in most children with lumbar syndrome. So I think we really don't know what the risk is of arterial anomalies in lumbar. And we don't know either what happens with those blood vessel abnormalities. Do they also have a potential to change? In a small number of patients, like in PHACE syndrome, we really don't know the answer to that. So the first clue to a child having PHACE or lumbar syndrome is going to be that hemangioma, most likely. But then these are the things that are part of the workup for PHACE and lumbar. So as I just mentioned, an MRI and MRA imaging of the head and neck in PHACE syndrome is very important. And the neck is very important because the blood vessel changes also happen most commonly in the internal carotid artery, the artery which extends over your neck. So very important that that's included. Evaluation of the blood vessels in the heart can be done similarly with the chest MRI, MRA. Often what I'll do is an echocardiogram, which is just really like an ultrasound of the heart. And that's because MRI and MRA, as many of you parents know, requires sedation in most children and can be a long study. And so to try to limit that, I will do an echocardiogram most of the time, just to limit the amount of time my patient's under anesthesia. And then an eye examination is important for PHACE. In lumbar syndrome, a spinal MRI is important whenever the hemangioma affects the lower back or anywhere in the buttock area. We need to check for that tethered cord. The only exception to that is sometimes in lumbar, the hemangioma will just affect the pelvic area. So the front of the body and the back of the body is not involved. And in that situation, We don't have enough evidence yet to support doing spinal imaging in those children. We do an ultrasound of the kidneys and the pelvis to look for kidney differences, differences in the way that the organs, the urogenital system developed underneath. And then when the leg's involved, I think imaging the blood vessels in the leg is important. Sometimes over the leg, as I mentioned, there's a difference in the size of that leg, the skin of the or the hemangioma that affects the leg can be very prone to ulceration. So that can be evaluated by doing a Doppler ultrasound of the leg. There are diagnostic criteria now for FACE and lumbar syndrome, and diagnostic criteria for FACE we first developed in 2009, I believe, and then those were revised in 2016. We just established diagnostic criteria for lumbar syndrome this past year, so that's just been within the last 6 months or so. And for you all to know, diagnostic criteria are really important as far as for your child, first of all, but also for research purposes, because when Dr. Siegel and I and our colleagues are studying FACE and lumbar, we want to make sure that we all agree on the group of patients that has that diagnosis, right? It makes our research more valid, and yeah, it makes it more significant to know that those children actually satisfy diagnostic criteria. So for lumbar syndrome, that was the very first step in really trying to promote more research on lumbar syndrome as well. So if one of your physicians is looking for those diagnostic criteria, they were published by another dear friend and colleague of Dr. Siegel's and mine, Maria Garzon, in Pediatrics. That's the name of the journal, in 2016. And then the lumbar diagnostic criteria were just published in the Journal of Pediatrics, as I mentioned last year. The lumbar diagnostic criteria are a little bit simpler than the FACE diagnostic criteria. Yeah, and just remember that most children do not have everything in those acronyms, maybe just, one or a few. Okay, how do we manage the hemangioma in these syndromes? Well, very similarly to how do we manage complicated hemangiomas in general. So treatment of choice when medical therapy is needed is oral propranolol. That's our gold standard medical treatment for hemangiomas that are complicated, large, or more extensive, like we see in FACE and lumbar. By far and away the most effective and the safest medication we have for hemangiomas. For FACE children who have, so in that 2016 paper that Dr. Garzon and colleagues wrote, there's also categories of the blood vessel involvement in FACE syndrome. When children have blood vessel involvement in the head and neck area, they're categorized into, higher risk, lower risk categories. In children who have higher risk blood vessel abnormalities, so that's higher risk for change, for progression, a neurology consultation is advised. As far as wound care for ulceration, especially, this can happen in FACE syndrome, but even more commonly in lumbar, we use propranolol for that reason too. But sometimes when ulceration is happening, it's now been recognized that lower doses of propranolol can lead to quicker healing times than just using standard doses of propranolol when ulceration is occurring. Pain management. So wound care is standard for ulceration, so good barriers, dressings when we can do that. Then low dose propranolol and pain management is super important. Sometimes too, we'll do, so there's a type of a laser called pulse dye, which is our most common laser we use in pediatric dermatology for vascular birthmarks. And that can also be used to help with pain and healing for ulceration. Not first line, but if we're really not getting quick enough healing with wound care or propranolol, that's sometimes something that I will use. Later for children, lasers can also be helpful for other skin changes in FACE and lumbar. So as some of you may know, and I'm sure Dr. Braun will talk about this a little bit more on Tuesday, but sometimes children who have face and lumbar, um, even with propranolol, and propranolol has done such a good job with hemangioma healing and leading to the very best outcomes with the skin. But even with that, sometimes there can still be, broken blood vessels left on the skin permanently, or a little extra hemangioma tissue. If there was ulceration that happened, sometimes there can be some scarring that occurred or discoloration of the skin. So oftentimes in my face and lumbar children who have, more than one type of skin change, I'll use more than one type of laser because different lasers target, they have different effects on the skin. So sometimes I'll use combinations of treatment. And then long-term monitorings. This has been established for really well established for face syndrome, more than lumbar to date. But in children with face syndrome, we want to watch out, for things like delays in development, learning differences, so we can be proactive about getting your child assistance with school and being prepared for those things, helping them catch up. There can be swallowing and feeding difficulties uncommonly in face syndrome. Migraine-like headaches is something that Dr. Siegel has really studied well, and those can be really debilitating in some children, something that, we're really trying to figure out the best way to manage. Hearing loss can happen in face syndrome, especially when, just thinking back to the picture I showed you of the different hemangioma patterns, when the hemangioma has that C-shaped around the ear and scalp, sometimes there can be hemangioma tissue inside the ear, or sometimes there can be differences with the way the nerves that conduct hearing, they can be affected. So that can lead, either one of those can lead to hearing loss. As I mentioned, there can be things like growth hormone deficiency in face syndrome. So following children's growth curves is important. And then the dental evaluation, really important, that happens at age 1 year. And then when children get their first permanent tooth, which is usually around 6 to 7 years of age, x-rays are recommended, panoramic x-rays to evaluate for sometimes there can be abnormalities with the roots of the teeth, for example, that need to be addressed. And then sometimes we'll repeat neuroimaging in some children with face, especially in that high risk category. In lumbar syndrome, to be honest, so in lumbar syndrome, we have the diagnostic criteria was our first big step. So, and Dr. Siegel with the face registry is also trying to engage lumbar families as well, because we have very few patients with lumbar in the registry. We don't have any long-term outcomes data or research. So we really don't know what to look for in lumbar children over time. And that's something that we're really hoping to learn more about and share with you all over time. And a lot of what happens in lumbar too is very specialty dependent. For example, this tethered cord can be repaired by neurosurgery, genital anomalies by gynecology. So specialists, just like face syndrome, are very important in management. And then future directions. So I can't say enough about this community, the face syndrome community and the face registry. Dr. Siegel will talk about the registry. Can we find some, gene target, some influence there that we could potentially target with medical therapy in the future? I think that's all of our hope. We need more natural history studies in both face and especially lumbar to learn, how to monitor children over time, what happens to children as they enter adulthood, which we now have our first data about that. Patient-centered outcomes. This is something I really wanted to mention. That, so in the PETRA group, the Pediatric Dermatology Research Alliance, Maureen actually comes to those meetings, and she's there and she's listening to research that's being done and answering questions. And we are hoping to do the same thing at the family meeting in Boston this summer, which I'm really hoping many of you can attend, because we, as researchers, we want you all families to be engaged in the research questions that we're asking. We want to make sure that the research we're doing matters to you all. Are we answering the questions that you really have? Are we addressing the priorities that you all have? So your voice is very important. So please, give us feedback. Your presence on this call is awesome, and please keep being engaged. If you can make the family meeting this summer, we would love to talk more about the research that we're thinking about doing, and getting feedback from you all on what you think we should be doing, which we would love to hear from you. And then patient and family support, as you all know, it takes a village for children and their families with PHACE and lumbar, and this is a wonderful village to have. So please take advantage of being in this community, reaching out to others, reaching out to younger families. You all who are seasoned PHACE or lumbar syndrome parents know what that felt like when your baby was first diagnosed. So thank you for being there for our newer, younger families. And yeah, I just can't tell you how grateful I am to be part of this community. And I will pass it over to Dr. Siegel, and then we'll have some time for questions.
Thank you. And then if you just stop sharing, and then I'll start sharing. Right, almost there. Oh, it didn't quite share. Hold on. Okay. Hi, everybody. Well, it's really nice to see you. I see a lot of familiar faces, or familiar names anyway, and welcome to everyone who's tuning in after to listening to the recording. So I just have a couple slides because I want to make sure we save some time at the end for questions, but I wanted to just update anyone who's not familiar with the registry on how to get involved and why to participate. So, oh, and I should have said, I guess, I'm Dawn Siegel. I'm a pediatric dermatologist at Stanford, and I've been studying PHACE syndrome since the beginning of my career, when I first was a fellow at UCSF with Alona Frieden. And so it has been such an important part of my life and my career. And the PHACE syndrome community has been an incredible partner and friend in this work. So participation in a registry can help make research possible to publish papers that can help educate doctors. And honestly, that's one of the main driving forces of our work. So by being able to do these natural history studies over time, kind of understanding what happens, research and evidence is so much stronger if we have larger numbers. So if it's just one case report of one thing that happened to one person, we don't know if that was just a coincidence or if that's really something we need to be watching out for. And so the more people that we can get, the better we can understand what's really happening and what the true risks are. And the study that Mitchell Braun is going to tell you about in a couple of days, of the 10 and up study, they had over 100 patients, was just so incredibly valuable to be able to study over 100 people and see what's really happening. And then, so by understanding what happens over time, then that helps us develop better care guidelines so that we know what imaging studies do we need to do and how often do we need to repeat them, and what things do we need to look out for. And I just want to call your attention to this paper, Facing PHACE 25 Years Later. I think it's on the PHACE Syndrome community webpage, and it's freely available. And it has some just really nice tables, I think, at the end that kind of tell you in infancy, these are the things to look out for. And in toddler years, look out for these things, and in adolescence, et cetera. So those are, some of the reasons to participate. So if you decide that being in a registry or participating in research is for you, what would happen? First, we would set up a call where we would just kind of find out a little bit more about your family and your child or you, and whether this is the right registry for you. And then if it sounds like it is something that you qualify for and that you're interested in doing, then we would do some consent forms, which you sign online. We email them to you, and then you can do an online consent signature. And then we would review the medical history. We can, get the records in so that we can look at the imaging reports and other studies and testing that has been done. And then we're hoping to roll out an annual health symptom survey as well. So that's how we can kind of keep track of what's changing over time. This is our flyer. So if you want to take a picture of this QR code, you can scan it, or you can email us at faceregistry@stanford.edu. And we also have a contact phone number there. And then at the bottom of this page, I just wanted to highlight that we have, we have a website. And I was thinking this was going to be the link to the FACE education book. But this is a different link. That one is, I believe, also on the FACE syndrome community webpage, and it's at Children's Wisconsin still. But we are hoping to update the educational book that we have for FACE and lumbar syndrome. So it's a really handy thing, both for your families to read about and learn about the condition, but also if you live in a place that doesn't have a lot of experts, you can bring this, the link to the online book or the actual hard copy book, which once we make a new one, we can mail out to families, and they can take it, if you ever have to go to the emergency room or go see a new doctor and they never heard of FACE, then you could show them this book and it can be really helpful. And so if you just want to do the kind of natural history part, that's totally fine. And, just the clinical records, you can participate just by doing that. If you're interested in the genetics, then we'll sometimes collect a blood sample or a saliva sample, or if there's going to be a surgery, we might get a piece of the tissue sample that was removed. And that allows us to do some different kinds of genetic testing that we can talk about in a minute. And then in some cases, we'll ask for blood samples from the biologic parents as well. If you decide to participate in the genetic part, right now, the way we're doing that is we're partnering with this program called GREGOR, Genomics Research to Elucidate Genetics of Rare Disease. And this group has funding and expertise to help with some of these studies. And so it would be a second consent form that your family would do. And then they can arrange to have a blood draw done at a quest near your home. So it's really handy way to be able to participate in the genetic studies. We're only doing, a small number of families in the GREGOR program, maybe 10 to 15. And so we're getting close to our maximum number, but we just still do have a little availability if you're interested. So as Denise was mentioning before, a big driving motivation for the registry is what is the cause of FACE and lumbar? And we're not entirely sure yet, but we definitely are getting more and more clues and more ideas. So we've done some just basic kind of generic genetic studies, and there isn't a specific gene change that everybody has. We've learned now about a lot of the other vascular anomalies. And for example, port wine birthmarks or capillary malformations, they're always caused by the same gene, GNAQ or GNA11, just a small number of different changes always cause that birthmark. But in FACE and in hemangiomas in general, it's been much more complicated, and we haven't quite been able to figure out, one really simple thing that everybody has. And one question is it that it's not in the blood, but maybe it is just in the tissue and just in a couple cells within that tissue. And that's called mosaicism. And to look for genetic changes that might be caused by mosaicism, that's when we need those tissue samples to study that. So right now we're not actively studying, heavily studying tissue samples for face and lumbar, but we are actually very actively studying sporadic hemangiomas or just hemangiomas in general. So hopefully that, I'm thinking that could provide clues to what's going on in face as well. And so we think face might be a combination of different factors, possibly multiple different genetic factors together, or possibly gene plus environment, or other prenatal factors, but we really aren't quite sure yet. So we're going to keep working on this, keep studying it with a variety of different genomic studies. And one really cool thing that I just wanted to highlight are these cardiac vascularized organoids. This is this really fun new technology where you can actually take a blood cell and you can convert it. You can reprogram it so that it grows a little beating heart, and then you can study, what gene changes might cause differences in the heart or the aorta, we're thinking, in this case. So those are some, interesting things that we're going to be able to, new technologies we're going to be able to take advantage of. And then just once again, here's our QR code and face registry at stanford.edu. And let me know if you have any questions. So we'll open it up because we want to save 10 minutes